Mother's Day is approaching, and it's not only a day to celebrate mom, but a great time to consider the importance of women's health. And the University Health Partners of Hawaii and John A. Burns School of Medicine makes it their mission to ensure women are covered in all stages of life.
Women have many unique health issues throughout their lives, from puberty all the way through pregnancy, postpartum, and through menopause. Physicians here at the University Health Partners of Hawaii are here to help them with some of those really critical times in their lives. Hi, I'm Dr. Miriam Seitz. I'm a board-certified OB/GYN doctor and a urogynecologist with the University Health Partners of Hawaii. I'm also an assistant clinical professor at the John A. Burns School of Medicine. I help patients when they have overactive bladder, waking up at night to go to the toilet, or if they are having leakage of urine, we call urinary incontinence. 1/3 of all women will develop some of these problems. So I'm just going to listen to your heart. Some of it happens after childbirth, and then some of it's just related to all the complex changes that happen with hormones at different ages, as well as other medical conditions like diabetes. Here at University Health Partners of Hawaii, we really understand that we're asking you to come and talk about very personal things. We're here to listen and we're here to help. Coming in for those postpartum visits is helpful to catch some of those things before they progress. We definitely don't want people suffering in silence. Some of these problems are very common. Over 30% of women will have incontinence or prolapse symptoms, and it's a topic they don't talk about when they're getting their nails done or out with friends. We want you to know that we're here and that we certainly aren't going to judge anybody. Even if you don't know what's causing the problem, we're here to start from scratch and try to help you figure it out. Not only are we here at Palimomi, the University Health Partners of Hawaii also has a women's center at Kapiolani Hospital in Punahou and also in Hilo. Postpartum care is very important because not only does it speed up the patient's recovery and return to all their normal activities, but it also can prevent other problems from progressing. Patients can present with issues relating to breastfeeding or clogged ducts or abnormal vaginal bleeding. Also some changes to mood that can happen after delivery. Being a mom means you're taking care of other people all the time, and you need to find time to make sure that you're taking care of yourself. So this Mother's Day, try to think about the things you can do that will improve your quality of life, which will definitely improve the care that you can give to other people as well. We're here and we care, and we're ready to help in any way we can. We are taking new patients, so all you need to do is call our office, 808-671-0090, or you can visit uhphawaii.org.
This segment is sponsored by University Health Partners of Hawaii and the John A. Burns School of Medicine.
May is the season of graduations, and today we're sitting down with a recent MD graduate from the John A. Burns School of Medicine, Michael Brigoli. Aloha to you, and
Aloha.
Congratulations.
Mahalo.
How are you feeling?
Excited.
Yeah.
Relieved.
And you have quite an interesting story. Tell us about your journey.
Well, my journey to medicine is a little convoluted. So I grew up in foster care for a little bit, homeless for a short period of time. So when I graduated high school, I didn't think I could be successful in college. Eventually, I made my way into the Army and was fortunate enough to become an Army medic. But before I left for my first duty station in Alaska, I reconnected with a friend from my hometown in Pahoa, my wife, Joy. We've been married for 22 years now. So she came up to Alaska with me, and we had a great life there, but we felt like something was missing. We wanted to reconnect with our roots and start our family. So we decided to come home, and I was very fortunate to be offered a position with the Big Island Fire Department as a firefighter paramedic.
Okay, so how did you finally get into medical school?
So I spent 13 years as a firefighter paramedic on the Big Island, and during that time I just got to see day in and day out the impacts of the severe physician shortage that we have there. We're over 40% short of the number of physicians necessary to care for our community. Because of that, the culture has changed. People who have routine medical conditions like a cough or chronic pain that's normally cared for at the primary care level are now calling ambulances to get in front of a doctor sooner. One day I was on one of those routine calls when a call that was critical came in, and while I was transporting my patient, I found out that the chest pain call became a cardiac arrest call. And when I got to the hospital and saw the other ambulance come in, I realized that it was my uncle, and he didn't survive the day. So to me, because I wasn't available, another ambulance had to come in that was 15 minutes further away. And while the physician shortage, a lot of times people talk about not being able to get into their doctors for weeks on end, we are really suffering because it's more than just that. We're actually, it's costing us people's lives.
Wow, so what are your next steps now that you graduated?
So I'll be doing my internal medicine residency at the University of Arizona, College of Medicine in Phoenix. So the goal is to finish my internal medicine residency, do a cardiovascular medicine fellowship, and return home to the Big Island to serve as a cardiologist for the community.
That's amazing. Well, thank you for all that you do. I wish you the best of luck and congratulations once again. We'll have the segment up for you guys on HighNowDaily.com.
This segment is sponsored by University Health Partners of Hawaii and the John A. Burns School of Medicine.